I am staying optimistic about this whole situation for multiple reasons that I will talk about as I go through. But mainly the fact that our vaccines are being rapidly deployed, and our increase has been significant, especially in these last few weeks. Nationally, we are hitting the targets that we want to hit in terms of the vaccine. People are responding to the vaccine. We've had an excellent response rate here in Palm Beach County. Together with the healthcare district, we're seeing that 18 to 44-year-old group, that's the one that is causing these cases to go up, are asking for appointments. That is very, very encouraging. And so with that, I'll continue going through. So we are concerned about this. I will also talk about the variants and our breakthrough rate and so forth, but I want everyone to, that this is the reason that there's so much concern about the fourth wave. So our numbers, just to, I'll let Mary go through those more exact in terms of our graphs and so forth, but as you can see, what I'm talking about here is that our total positivity has remained high. It's still increasing. Our daily positivity has gone up a bit. We're now at 6. We had been in the 5s for quite some time. We actually reached 7 on Sunday, 7.7. Our number of tests have been fluctuating up and down. We've gone as high as 8,000 and then as low as 3,000, so they're fluctuating. There's still plenty of testing sites throughout Palm Beach County, and lots of places where people can get tested. The ballpark continues to do testing, rapid testing. You get your results right away, and they have plenty of volume. There are no long lines anymore. And then this one, our number of cases per day has gone up just a little bit. Our average for 14 days is now 369, just up a little bit. But we're staying below that 1,000, so our contact tracers are happy about that. The hospitals and the ventilator use and everything is quite appropriate, and Mary will give you more details on that, so we're not worried about the hospital surge. That's another reason that I'm staying optimistic, that although we are seeing these cases, because we have vaccinated such a large percentage of our seniors, that we're not seeing the deaths. Because if you remember, the majority of the deaths were in the 65 and over. So the fact that we have blanketed the senior population, those people are now safe and will not end up in the hospital, will not end up dying. Just very briefly, we're now at the 16 or 18 years of age in order to get vaccine. Depends on whether you have the Pfizer, allows for 16-year-olds. 18 is for the rest of the vaccines. In terms of our phase of where we're at, I've put us in phase 2 here, kind of in the middle, but we're almost getting very close to that phase 3. I think in the next 3 to 4 weeks, we're going to see even more vaccine coming on board. At that point, we're actually talking about having now the physicians getting the vaccine. They've been able to now order on Florida shots. That means the doctors will be getting vaccines. Some of them, believe it or not, have turned the vaccine back. I'm not sure why that's happening, but some of them don't want to store it and so forth. That happens in some doctors' offices, that they decide to let their patients go to the health department to get vaccinated. But they are able now to get the vaccine. More and more of that vaccine is going to flow out to them. I recommend that people accept whatever vaccine is available. If they turn vaccine back because everybody wants the Johnson & Johnson, that doesn't make sense, because not everybody's going to be able to get Johnson & Johnson. So I highly recommend that whatever vaccine is available, that's the one that we go ahead and get vaccinated with. Going forward, this is our 5 metro counties where we continue to see Palm Beach County leading in terms of the 65 and over. We're at 76% for persons that we vaccinated over the age of 65, ahead of Broward and all the other counties. In the 60 to 64, we're at 52%, just slightly averaging the same, with the exception of Broward, that's at 56%. For the 55 to 59, we're at 37%, and you can see the difference here. And then in the 50 and above, which we just started, we went from 18% just a couple weeks ago. We've gone all the way up to 32%, not too far away from the rest of the group. So I think very quickly with the vaccine we're getting now, we're going to catch up, especially with the appointments that I saw and the vaccine that we have gotten for the healthcare district. They're going to be able to do massive numbers of vaccines and appointments right now. We were able to take the vaccine that was left over from some of the strike teams that had come and given that Pfizer over to the healthcare district. The healthcare district has also gotten, as well as the other FQHCs, have gotten their supplies from the feds. That's a tremendous amount of vaccine also coming into the county, as well as multiple strike teams that are coming through. And I think Mary will highlight some of that also. So we've got a lot of vaccine right now. We need to take advantage of that and get everybody vaccinated. I want to congratulate the public. They're keeping up with where the sites are, and they're coming, and the vaccine is being moved into arms. The variant, a lot of people asking questions about the variant. So the variant have continued to increase quite a bit. This is the map from the last time I showed you, where Florida was at 1,070. We're up to 3,568 since our last visit here at the Board of County Commissioners. You can see also that California has increased to 865. Colorado is beating California at 917. And Michigan, which was the only other blue color, is now at 1,242. So what do we look like here in Florida, in our three counties? Broward continues to lead by quite a bit, but now we have all 5 of the variants that are being tracked. That includes the South Africa variant, which is very small. This is red here. Dade and Broward does not have it. We do. Then we have the Brazil and the Japan. Those two have been put into one. That's the P1. That is this number here. And then we have the UK, which is the largest one. That is the one that's spreading the fastest and the most numbers in all states. And you can see the difference, 824 versus 287 and 429 for Dade. And then we have 2 that are U.S. These are both California variants that have been mutated here in the United States. And those are these other numbers here that you see. So overall, the big one that could become the predominant virus would be the UK virus. And that's concerning, not because it's more lethal, but because it's more contagious. So in order to stop that, the main tool that we have is the vaccine. We have got to get everybody vaccinated so this virus cannot spread and become the dominant virus. And that's worldwide, that's not just here. So for that reason, we need to continue wearing our mask, washing our hands, and watching our distance.